Phlebotomy Certification Exam 2026. Question 1. A phlebotomist must draw blood from a patient in a room marked with contact precautions for Clostridium difficile. Which of the following is a mandatory action after the procedure? Wear an N95 respirator. Use an alcohol-based hand sanitizer. Wash hands with soap and water. Leave all used supplies in the patient's room. Clostridium difficile forms spores that are resistant to alcohol-based sanitizers. Therefore, proper infection control requires washing hands with soap and water to physically remove spores and prevent transmission. Question 2. When preparing a peripheral blood smear from a capillary puncture, what is the most important characteristic of the final slide? A thick, dark staining layer of blood. 2 drops of blood placed side by side. A feathered edge. Blood covering the entire slide. A feathered edge provides a thin layer of evenly distributed cells, allowing accurate microscopic examination and differential counts without overlapping cells. Question 3. During a venipuncture, a patient reports a sharp shooting pain radiating down their arm. This is a sign of potential injury to what structure? A tendon. The brachial artery. A nerve. The bone. Sharp, shooting pain is a classic sign of nerve involvement. Immediate needle removal is required to prevent permanent nerve damage. Question 4. What is the correct order of draw for a capillary specimen collection? Lavender, green, serum. Serum, green, lavender. Blood gas, lavender, green, serum. Green, lavender, serum. Capillary collection order prioritizes specimens most affected by clotting. Blood gases first, followed by EDTA, then other additives, and finally serum tubes. Question 5. In relation to venipuncture needles, what is the relationship between the gauge number and the diameter of the needle? Gauge and diameter are unrelated. Larger gauge means larger diameter. Gauge equals diameter in mm. Smaller gauge means larger diameter. Needle gauge is inversely related to diameter. A smaller gauge number indicates a larger needle lumen, allowing faster blood flow. Question 6. A complete blood count, CBC, is ordered. Which laboratory department processes this test and what tube is used? Chemistry green top. Coagulation light blue top. Hematology lavender top. Blood bank pink top. CBC is processed in hematology and requires EDTA anticoagulant found in lavender top tubes to preserve cellular components. Question 7. A phlebotomist needs to collect a sample for a cold agglutinin test. What special handling is required? Protect from light. Chill in ice slurry. Keep warm at 37 degrees Celsius. Centrifuge immediately. Cold agglutinins cause RBC clumping at low temperatures. Keeping the specimen warm prevents inaccurate results due to agglutination. Question 8. The process of transferring a portion of a specimen from one container to another is known as aliquoting, centrifuging, accessioning, calibrating. Aliquoting refers to dividing a sample into smaller portions for multiple tests, ensuring efficiency and sample integrity. Question 9. An unconscious trauma patient arrives without identification. How should specimens be labeled? Wait for identification. Use temporary ID number. Use John Doe. Use room number. Facilities assign unique temporary identifiers to ensure proper specimen tracking and avoid misidentification errors. Question 10. A phlebotomist using a butterfly needle collects a light blue tube. What must be done first? Draw red tube first. Use discard tube. Invert vigorously. Fill halfway. Butterfly tubing contains air, which can underfill coagulation tubes. A discard tube removes air to maintain proper blood to additive ratio. Question 11. When transferring blood from a syringe to evacuated tubes, what is the correct procedure? Reverse order of draw. Use large gauge needle. Pierce stopper with syringe needle. Use safety transfer device. Using a safety transfer device prevents hemolysis and needle stick injuries while allowing vacuum to fill tubes correctly. Question 12. During venipuncture, swelling and bluish skin appear. What is the first action? Finish quickly. Apply cold compress. Release tourniquet and remove needle. Ask about pain. These are signs of hematoma formation. Immediate cessation of the draw prevents further tissue damage. Question 13. A test requires the patient to be in a basal state. What does this mean? Fast 4 to 6 hours. Avoid exercise 48 hours. Sleep 8 hours. Fast and rest 8 to 12 hours. Basal state requires fasting and no physical activity to ensure accurate baseline metabolic measurements. Question 14. An infant undergoing frequent blood draws is at risk of what condition? Iatrogenic anemia, polycythemia, hemochromatosis, thrombocytopenia. Repeated blood collection reduces total blood volume, especially in infants, leading to anemia caused by medical intervention. Question 15. What is the function of sodium fluoride in gray top tubes? Separator gel, glycolysis inhibitor, clot activator, anticoagulant. Sodium fluoride prevents glucose breakdown, preserving accurate glucose levels for testing. Question 16. What must be done before centrifuging a serum separator tube, SST? Invert tube. Place in ice. Allow to clot. Centrifuge immediately. Serum must fully clot before centrifugation to avoid fibrin contamination and ensure accurate results. Question 17. A bilirubin sample from a jaundiced infant must be handled how? Use cold pack. Keep warm. Protect from light. Transport vertically. Bilirubin is light sensitive and degrades when exposed, leading to falsely low readings. Question 18. Small non-raised red spots below a tourniquet are called hematoma, petechiae, edema, urticaria. Petechiae indicate capillary bleeding and may suggest platelet disorders or excessive tourniquet pressure. Question 19. Leaving a tourniquet on longer than 1 minute causes hemolysis, hemoconcentration, hematoma, petechiae. Prolonged constriction causes fluid loss from vessels, concentrating blood components and skewing test results. Question 20. The primary difference between plasma and serum is that plasma contains fibrinogen, hemoglobin, platelets, white blood cells. Plasma contains clotting factors like fibrinogen, while serum is plasma without clotting components.